Go ahead.
All right, so for looking at, this is a normal tendon, you can kind of see how thin and almost like pencil-like it is.
Yeah.
And then today you can see it's very ill-defined and very widened. This isn't a direct measurement there, but definitely if we compare about the ratio of that to this, much, much larger. And that would definitely serve to explain why he's having such a rough recovery. It's a pretty rare condition that we can sometimes see in post-op TPLO patients. More often it's patients who are pushing it too hard, so they're kind of putting that patellar tendon through repeated trauma, micro trauma, and then that causes inflammation in that area. The good news is there's nothing surgical we have to do here, and the actual surgery site's healing great.
Oh, that's good news.
Basically, if I just saw this without that, I'd be like, we're gold. But now that I see this, that explains a lot of kind of what's been going on.
So you're saying that maybe he's had too much activity?
For him.
For him, okay.
Yeah, because obviously he's been rested really well, but sometimes, relative activity can sometimes, even for, not to say Dasher's chunky, but he's on a little on the heavier side, so maybe a little bit was even a little bit too much for him.
Well, he did have when I was out, he did have a jump from the bed. He got on the bed, the door was left open, etc., and he jumped off, and that's when he went back. And in other words, he lost some of the
But he also kind of had that episode, like a couple weeks post-op, where he had like a similar thing, where he had like, doing okay, then a setback.
Yes.
So part of me wonders if maybe he's had a little bit of smoldering, and then maybe him jumping off just kind of like caused a little bit of a flare up there.
Okay.
That's, if I had to guess, that's probably what's been causing him some difficulty during his recovery. There's good news and bad news with it. The good news is we don't have to intervene. The bad news is we got to wait it out.
We've got more time.
So I do want him to continue on an anti-inflammatory. It sounds like he's tolerating the meloxicam well.
Yes.
And he's on the liquid.
No, he's been doing the half pill.
Okay, yeah.
And then he's been doing gabapentin. 2 to 3 times a day, but to be honest, I've been doing 3 times a day because it's been more painful.
Yeah, for sure. I think I want to probably continue those for another 2 weeks.
Okay.
Do you have enough of that Medicam, or do you need
Is that the same as
meloxicam?
It's the same thing. I don't think I have 2 weeks worth. I probably have another week, maybe a week's worth.
I do need to see if we have the same formulation. We typically have the liquid form, so I'm not sure if we'll have the pill form. Does he do better with the pill form?
I haven't done the liquid
yet,
so
all right.
Do you think that could make a difference? Or?
No, it's the same efficacy and everything like that. The pill is just the human, or more of like the human form of it, because it's much more potent. So I typically use the liquid form, but they're exactly the same medication. But I do want to continue him on that because I do think that's going to be helpful for the inflammation here. And I just want to back us down to just pretending like he was in his first or second week. Just very, very rare short leash walks, 5-10 minutes, no longer than that. And then ideally what I'd like is probably an update on how he's doing in about a month, because by that time he should have incrementally improved to the point where he's pretty much normal at that time. I don't think we need to take another set of x-rays at that time because bone-wise it's healing well, so it'll be primarily how's he doing clinically on that limb.
Okay.
Because if he's still doing okay at about a month out, then we're going to taper him, or I guess we're going to ramp him back up again. But for now, I want to back us down a little bit, stay off of that